Mental health parity is a very simple concept. The simple concept is that mental health and substance use disorder coverage should be no more restrictive than insurance coverage for any other medical condition.
Connecticut is one of the worst states in the nation as far as providing mental health parity, and that's why this bill is so important.
Every single one of us represents districts that are full of people who have mental health and substance use disorders. 1 in 4 Americans, 1 in 4 people in Connecticut, 1 in 4 people in our cities and towns are struggling, and they need us to step up. We cannot afford any longer to treat substance use disorders any differently than any other disease.
On July 13th of 2018, my family suffered a devastating loss when we lost our son, Alexander Pelletier, on his 26th birthday to an accidental overdose in Canaan, Connecticut.
We went through multiple rounds of treatment therapy for him, and every round was faced with the same challenge of getting insurance companies to agree to a full set of treatment. It cost us well over $100,000 probably of our personal finances, which thankfully we were able to find a way to afford that. But there are so many people out there who cannot.
For families who have gone through this process, it's a difficult one. It's different than a physical injury. It's hard to face the stigma, etc., and seek out the care.
I think this bill is common sense. This is a question of making sure that we're enforcing existing law, which says that insurance companies are supposed to treat people the same, regardless of why they are seeking care.
This bill, the Mental Health Parity and Addiction Equity Act, is a modern-day medical civil rights bill for those with brain illness. It says that their illnesses ought to be treated equally as every other illness.
One of the most important things that the legislature can do this year is moving forward and making sure that everyone has access to mental health care and substance abuse treatment, and this bill will really make an important stride to make that happen.
This will help us align ourselves with the federal law and have consistency from one state to the other so that that law can be enforced and strengthened throughout the United States.
This is our year to make a difference in the lives of the people of our state who are having difficulty with mental health.